Thank you, everyone, for joining us today. Before we get into the coronavirus update, tomorrow is the last day to sign or veto legislation that was passed by the General Assembly. So I've dispensed with all the bills today. They've all been either signed or vetoed, as far as we know. If we're missing one, we'll get it tomorrow, but we think we've signed or vetoed all the bills. And I want to give a few of those highlights, particularly as they relate to our state's approach to the health crisis of the coronavirus and the economic crisis of the coronavirus. First of all, using coronavirus relief funds, the General Assembly provided direct housing assistance to help people pay their rent or cover their mortgage, help for families to pay their utility bills to keep their heat or air conditioning on, their lights on, support for small businesses, and assistance for those struggling with mental illness or domestic violence. We also approved $250 million in climber loans to assist our small businesses. We had very encouraging calls with the banks in the last few days on that. And we also passed legislation to provide paid sick leave for everybody in Colorado. If you're watching this and you're a salaried worker and you've always had sick leave, you might think nothing of it. But many hourly workers, most hourly workers, don't have paid sick leave. So somebody who works in food services, restaurant, a store, they might go to work sick because they simply have no paid sick leave. Now they will in Colorado. That's very important. For this pandemic, for us to be successful, people who are ill should not go into work. Nobody who has any symptoms should go into work because it could be a cold. It could also be coronavirus, which has active community spread in our state and often starts with cold-like symptoms. It can get substantially worse over time. We also made permanent the saving people money on health care through the reinsurance program, which has brought down rates about 20% in the individual market for health care. Also even more important because of COVID, because more people will be in that individual market if they don't have employer-backed health care. That extends that for 5 years. And I want to thank as well the entire legislature, but especially the Joint Budget Committee for doing the very difficult job of balancing our state budget. Unlike the federal government where they can have deficits, Colorado balances its budget every year. We made the tough choices. We tightened our pants. We balanced the state budget. Coronavirus, we're at 37,686 positive cases. That's 444 new cases today. We always want to take a moment and express condolences to those who we've lost. There have been 1,589 deaths due to COVID in Colorado, and about 1,700 deaths of people that had COVID, and it's a contributing factor often in those cases. And behind each one of those is a story. I mean, there's a family, brothers, sisters, sons, and daughters, and our heart goes out to all of the victims of coronavirus, not just here, but across the world. In terms of new cases, we continue to have an upward trend. 12 of the last 14 days have had an upward trend of the last 7 days, In hospitalizations, 11 of the last 14 days have had an upward trend in the 7-day moving average. The underlying message here is that cases are growing slowly but consistently. And that's the wrong trend. We want them decreasing slowly but consistently, which is a message to all of us that what we're doing is close but isn't quite working, and we need to do better, and that means reducing our social interactions. The models that we've shown about 60% social distancing, meaning if you were the type of person that socialized with 10 people last January, you should be trying to only limit your contact to 5 or 6 people now, and wear a mask. And remain 6 feet from others. If we do these things successfully, we will defeat the virus in Colorado. But we are continually coming up a bit short. Now, it's not the time to panic. It's not the time to feel anxious. It's the time to redouble our justified caution and to make sure that we take the steps that are in our power to control this pandemic in Colorado, save lives, save our economy. Right now, we have 252 COVID patients in hospitals in Colorado. That's both ICU and non-ICU. We have 552 open ICU beds right now. So we're not concerned about that yet. But, one of the reasons we want Coloradans to do better early is we don't want to have to take extraordinary measures as we had to in April to free up additional beds, like delaying elective surgeries, which frees up beds. Many states like Arizona and Texas and others have taken that step again, where they are not doing elective surgeries because they need those beds for COVID cases, many of whom make it, some of whom don't, even with the very best care. They don't all make it through COVID. So we can't let our guard down. At the press conference Wednesday of last week, we had 181 hospitalized. Now we have 252 that are hospitalized. And as I said from the very start, this is a marathon, not a sprint. This is not something that Coloradans should expect to be over in a day, in a week, in a month. There's a silver lining. We will get through this as a state, as a nation, as a world. I remain very confident there will be a vaccine or cure. There's some therapeutics that might have some limited benefit now, like remdesivir, but they don't fundamentally change the trajectory of the disease, even if they can reduce fatalities by a little bit. They're welcome. But we are hopeful that there will be a vaccine or cure, and we can all embrace one another and return to our lives and take all of our masks and burn them in a huge bonfire. But we're not there. This is a marathon, weeks and months, sustainable. We have to be sustainable. This is the way we're going to live. We're going to be smart about it. We're going to be careful about it. We're going to live in a way where we don't give the virus the opportunity to resurge. And we need to continue to calibrate over time. For instance, we don't yet know how bars can be open in this pandemic environment without leading to a resurgence. We see examples of what doesn't work around us. Many states in the country are showing what happens when we let our guard down. Devastation in terms of human life, and devastation of businesses and our economy for states that have had to have substantial closures of gyms, of theaters, of restaurants. Many of these small businesses already have had to deal with so much this year. If we care about our economy, it's incredibly important that we wear masks in public, stay 6 feet from others, and reduce our social interactions a bit more than we are currently doing. We need to live a little bit more like we lived in May, early June, and not celebrate a victory because we're only at the 12-mile point of this marathon. It's not the time to let up. I want to take a little bit of a detailed look at Texas. They started an effort around reopening. Of course, they had a level period, but then they had a period of exponential growth in early June that has not let up. And that drastic change has happened in Texas and would happen here if we let up in just a matter of a couple weeks. That shows how everything can change when we're dealing with the novel coronavirus the moment that we let down our guard. The virus is the virus. There are nominal mutations, but none have shown different epidemiological impact. But the virus is the virus. How much it spreads in a place like Colorado or a place like Texas or a place like Romania or a place like Poland just depends on the social environment that we give it to spread. And the minute that it has that social environment to spread, the minute there's large groups of people going together, whether it's a gym or a church, the minute there's large groups or a private party, this thing takes off. And that's why we all need to be very, very careful. Just to give some human perspective on this, the obituary section of the Houston Chronicle on Sunday was 43 pages long. Hundreds and hundreds of deaths, and the paper celebrated the memories of those loved ones. And we don't want the Denver Post or the Colorado Springs Gazette to have to, on any given weekend, run a 43-page obituary section just to catch up with those that they've lost in the last few days or week. In Florida, they have a number of hospitals, over 40, that have maxed out their ICU capacity amid coronavirus surge. One of our overriding goals that we set from the start in Colorado is we don't want to exceed our ICU or hospital capacity, because that means that people who have COVID or have other conditions like heart attacks or strokes won't get the care that they need. So it's very important that everybody who gets COVID has the best possible medical care and the best chance of surviving, and everybody who has a heart attack, stroke, appendicitis, any other condition also has that bed available to them. In Arizona, cases are similarly spiking. They are down to a small number of beds that are left. California is also seeing exponential growth in recent weeks, and it's effectively had to return to something closer to what our stay-at-home phase was in Colorado, banning many kinds of indoor activities. Thankfully, so far, Coloradans are doing better than our friends in Texas and California and Arizona. We're in a different situation. We are managed, we're operational, we're open, we're doing things, and we are keeping our case count relatively low, but we have to do a little bit better than we have been doing because we want to maintain this progress. We want to maintain a level that we exist alongside the virus while we seek a vaccine or cure, and we're not yet there. Because if we fail to, if Colorado doesn't make small mid-course corrections, if you as individuals, if Coloradans as individuals aren't reducing their contacts a little bit more, staying successfully 6 feet apart from others a bit more, not going to parties or large events with others, if we're not doing better at that, then we will no longer remain a positive outlier. We will fall victim to the same forces of the virus that has caused larger and larger casualties and greater shutdowns at a very great cost of human life and treasure in neighboring states. So here's what we need to do. It's not that hard. The biggest piece is individuals. That's probably 80% of it. It's your decision to wear a mask when you're around others. It's your decision to keep 6 feet apart, 8 feet apart if you can from others. It's your decision to stay safer at home when you can, to enjoy our outdoors in a socially distanced way. It's your decision to continue to protect those among us who are most vulnerable. And of course, wash our hands, practice proper hygiene. These are not exciting things, they're not fun things, but they're what we all need to do for the next several months. The state continues to work on acquiring personal protection equipment, ramping up testing, providing economic support for businesses and individuals, including the $250 million in climate loans to keep our businesses viable. Local governments are stepping up in mask ordinances and repurposing space to allow for social distancing. It's been great to see cities allow much safer outdoor dining. And beefing up their local public health agency capacity so they can handle outbreaks with the testing, the tracking, and the tracing right at the local level to prevent those outbreaks from escalating. And the business community, with so many businesses requiring masks for customers and being flexible, encouraging teleworking. The more teleworking we have, the more people can stay safer at home, the better our trajectory will be. And of course, taking steps to protect their workers as well as patrons in businesses that have public access. These are simple steps. No one says they're fun. No one says they're free. But they're what we have to do a bit better at if we're going to get through this. We're close, but we're not quite there. These steps have allowed us to be, so far, relatively successful from both a virus management perspective and from an economic perspective. Lower unemployment than the national norm, less deaths than the states that have been hard hit. But that is not some unique Colorado factor. It's simply a function of our individual decisions and actions. And this should be a warning that we need to do a bit better because our current trajectory is not one that is sustainable for many months. We need to do just a bit better and live more like we lived in May and perhaps early June. And I think some of us got a little bit complacent going into late June and early July, and that complacency needs to end. As a result of the wise actions and precautions that Coloradans have taken, our small businesses are performing better than the national average. It means they're keeping people on payroll, they're making their rent, the employee hours worked is strong, people are getting paid. Our unemployment rate, of course, is unacceptable, but it's 3 points lower than the national average. The bottom line is this: the key to greater economic and social activity is to get the simple things right, like wearing a mask when you're around others and staying 6 feet apart in your interactions. The fate of Colorado in both virus suppression and economic recovery is largely in your hands. So let's reduce our social interactions, remain 6 feet from others whenever possible, and wear facial masks when we're in public. Now, I've been saying that message in many different ways, through social media, humorous ways, strong ways, science, data ways, just pushing out studies that show the impact of masks. That's because different people make their decisions in different ways. I think it's important that we reach people in a way that's relevant to them. For you, it may be a patriotic appeal. If you care about America, if you care about Colorado, wear a mask. For others, it may be scientific. Maybe they read something a couple months ago that masks weren't as important or didn't matter. They need to see the studies of the last few weeks that show the strong benefit of masks, not just to prevent you from spreading it to others, but by reducing your own risk of contracting the virus by as much as 2/3 if you're exposed. Now, that being said, masks are not a substitute for social distancing. If we had no social distancing and wore masks, this pandemic would accelerate in our state. We need both. We need the social distancing, the effort to stay 6 feet apart, reduce your number of contacts with other people, avoiding large groups, and mask wearing. And we can rebound from this, save lives, keep our jobs, grow our economy. There are Paycheck Protection loans that are still available. You can apply until August 8th. If you have a small business and you read about it but you didn't have time to do it. Take advantage of it. It's a federal program that will help you keep people on payroll. ChooseColorado.com for more information. And thanks to the hard work of our team at OEDIT, Colorado's been getting more than our fair share of PPP loans relative to population. We want to do a final push for folks to apply who are eligible. In closing, you've probably noticed that I've been more direct than normal in asking Coloradans to wear masks. That's because I care deeply about Colorado. And frankly, I'm worried that Coloradans are taking our fragile success and our success relative to some of our neighboring states as somehow a signal that we're out of the woods, when that's far from the truth. We're not even close. And our neighboring states are sending us a warning. We simply can't get comfortable because, as we saw with Texas and other states, everything changes drastically, changes quickly. If we give the virus a social environment to thrive in, we cannot allow that to happen in Colorado. I don't want to follow the path of Texas, Arizona, Florida, and California, and I know that you don't want to follow the path of those states, a path that leads to more shutdowns, a path that leads to greater economic pain, and a path that most importantly leads to casualties and lost lives, brothers and sisters, fathers and mothers, sons and daughters. I want, and I know you want, Colorado to continue to be a positive outlier, and we'll continue to use the best science and data that we have at any moment to adjust our response as needed to meet the conditions that we are seeing in the data every day and every moment. With that, I'll take some questions. Yes?
Governor, so you're continuing to say that these numbers are going up. I get the feeling that at some point you may say that we may have some sort of rollbacks in the freedom that we have now. Is that coming?
I hope not. I hope that Coloradans are taking these warning signs seriously and are wearing masks when they're around others, are reducing their social interactions, and are making a deliberate and successful effort to stay 6 feet from others when they have to interact with others, and avoiding large groups. So if Coloradans are doing these things, we can continue to be a positive outlier, but the moment that we let up, the virus can return to exponential growth in our state, which will mean that Coloradans will have to take more extraordinary measures to protect themselves than the simple ones that I've outlined. Mm-hmm.
Yeah, you said that the small businesses in Colorado are faring better than nationally. What is the state doing to protect, say, minority businesses during this time?
The state legislature passed a $20 million assistance fund that the focus is helping businesses that weren't able to participate in the Paycheck Protection Program, including minority and women-owned businesses. We also hope to prioritize assistance for women and minority-owned businesses through the Climber Fund credit facility. Telephone?
Governor Polis, it's David Clue at Denver 7. You've explained your reluctance to issue that mask mandate statewide. You've also made it very clear how you feel about those who refuse to wear masks. Yet dozens of counties and cities insist they will never violate the personal freedoms of their citizens by mandating masks. Why is that the wrong message? And how did this become so political?
Well, it's a tough one to wrestle with because, like most Coloradans, I believe in bodily autonomy. I believe that people should make their choices. I recently condemned on my page the China forcing their minority population of Uyghurs to have forced abortions. And, you know, in the same breath, I would condemn any government that stands in the way of a woman making their own reproductive choices. Coloradans value their bodily autonomy and their liberty, but the reason this issue is more complex is it's not so much about just your rights. It's also about protecting the right to live of those who are impacted by your decisions. We have speeding laws in Colorado. It's not to say you know, that when you make a decision to go 89 and 90 miles an hour and put yourself at risk, that's one thing. But when you put other drivers at risk, that's another. When you don't wear a mask and you're putting yourself at risk, that's one thing. But when you're increasing the risk to others that you encounter because of the large instance of pre-symptomatic and asymptomatic spread of coronavirus, that's another entirely. So I don't think there's any bad faith here. I think that Coloradans are trying to balance our sincere belief in liberty and bodily autonomy with the understanding that these decisions affect others. And that's why many municipalities have led the way in putting in meaningful mask ordinances that have increased compliance in their area, especially in some of the heavily tourist areas. It's very important that as people interact with people from hot zones that both parties are wearing masks. And we have over more than half the state, more than half the population of the state is under some form of mask ordinance. What's important is whether it's required in your area or not, the rational choice is simply to wear a mask. It's not just about protecting others. It's not just about protecting yourself. It's also about protecting your job, protecting your economy, and protecting our lifestyle, which I hope people find this lifestyle of June to be sustainable. In early July, I mean, this is, as I said, I mean, you know, kids are in camp. You can go to the store. We can do a lot of the things we love. Of course, it's not the same way we lived last summer. We're forgoing parties and large get-togethers, neighborhood gatherings. Many Coloradans are forgoing church and forgoing going to the gym and forgoing the things that we love to do. But at the same time, we have to be in a model that allows us to sustain this for as long as necessary. And we hope that that's not more than a few months. There's promising studies being done on vaccines, including here in Colorado. They're recruiting volunteers for studies, and the production is being ramped up. In the optimistic scenarios, there will be vaccines that are available by the end of this year. We certainly hope that's the case. And the more successfully we are in containing the virus, the more we're able to engage in that social sphere, which is so important to all of us because humans are fundamentally social animals.
Hello, this is Joe Vaccarelli from Denver 7. We've heard from several viewers reports that they've been waiting for their test results, in some cases more than a week. Are you concerned at all about the state's ability to stay at its current phase of reopening, given kind of the backlog of test results and the troubles that causes for contact tracing? And is your office doing anything to address that issue?
Yeah, so here's what's happening with test results. The national testing partners, LabCorp and Quest, because of the enormous crisis in Arizona and Texas and Florida, are backlogged. They have a significant backlog, 5 or 6 days. The in-state testing, the state lab, the hospital partners, they continue to turn around tests very quickly. So if you go to Denver Health or Kaiser, National Jewish, because you're a patient there, you get tested, there's a very good chance that they turn that around in a day or two. The state lab is working on getting back to that 1 to 2 day turnaround. But the out-of-state processing has a backlog. We continue to encourage those companies to accelerate, but what we do control here in Colorado is we are rapidly increasing our own test processing capacity. Our state lab will be going from 2 shifts to 3 shifts, effectively running around the clock, starting in the next week. And we are also working with many other private labs here in Colorado to increase our own processing capacity so we can get back to that 1 to 2 day period, which maximizes the impact of tracking and tracing. What's really important for folks who get tested, who have to wait several days for results because they've been sent a LabCorp request or take a few days to turn around, is that you quarantine yourself during that period. Until you get your test results back to confirm that it's negative, act like you are contagious with coronavirus, because we can't afford to have you being able to go out and interact when we know that close to 5% of the folks tested are going to come back positive. If that's you, and you were out and about during those few days while your test was pending, you were jeopardizing the lives of others, as well as leading to this backslide that we've seen in so many other states.
Governor, so we know that there are some people, depending on which lab they're using, who are waiting 5, 6, or a week plus. And some people also can't really afford to sit at home in quarantine for all of those days if they have work or whatever other situation. I'm curious what you think, given this dynamic, about the sports leagues' plans to reopen, where they have plans for testing every 1 or 2 or 3 days. Nuggets, Rockies, others around the country, that they're going to use a tremendous amount of testing resources when this isn't available to the average person. Are you comfortable with that setup?
So the folks like professional sports teams, some colleges, when the kids come back, they are doing their own testing. They're paying for their own testing. They are not taking away capacity from the state. So private organizations like sports teams are not coming to the state and displacing other tests. They have made their own additive arrangements to be able to pay for and contract for the tests in their processing, which is appropriate for those folks to do. We welcome any company, any college that wants to do additional testing beyond what county health or local hospitals can provide, because it'll only help the public health situation by adding to our testing totals.
Governor, Steve Steger from 9 News here. 2 questions for you. First, the city of Glendale, surrounded by the city of Denver, is considering opting out of a local health order requiring mask use in public. Some people out there have said that if you had enacted a statewide mandate, it would prevent some inconsistencies like this. Do situations like this make you think differently about a statewide mandate? And then second, this weekend you called people who refuse to wear masks selfish bastards. Do you feel that that's a more effective strategy to get people to wear masks than your power to enact a statewide mandate? And do you think that someone who already wasn't going to wear a mask would be more likely to do that if you called them a selfish bastard?
So the point of that post was to highlight that even if you don't care about the health of other people, wearing a mask reduces your own risk of getting coronavirus by about 2/3. It was a study that I cited that was linked to the article, I believe, cited through UC Davis. I try every method of communication to convince people to wear masks. That means direct, it means humor, it means appeals to people's patriotism, both with regard to their pride of being Americans as well as their pride of being Coloradans. And all of these, I think I posted one where we photoshopped that I had a no suntan where I would wear a mask, and we said that that's like the equivalent of what ski goggles. Normally when people go skiing, you don't have a suntan here, so we call that the mask. Mask face. Everybody makes their decisions differently. Some react to humor, some react to blunt statements, some react to data, some react to peer pressure. This morning I posted that there's a guy named Jimmy, who's 95 years old, peanut farmer, survived brain cancer, and Jimmy wears a mask, and we should be like Jimmy. Of course, I was talking about Jimmy Carter, who had sent out pictures of himself wearing a mask. So everybody consumes media makes decisions differently. There's no one way to convince people to wear masks. I want to engage in every way I can to convince people to wear masks. And yes, of course, I want to take whatever action leads to Coloradans being safer. And we certainly haven't ruled everything out. The local efforts are always going to be the most effective because they are on the ground and tailored to the local situation. They have local enforcement capabilities behind them. But we want to send the message from the state and from me as governor in every way possible. If you care about your state, your nation, care about the lives of others, care about your own life, care about your job, care about the economy, wear a mask when you're around others.
Governor, you just talked about the idea that what's going on right now is not sustainable. I would imagine that you're starting to look at ways to put us back on course. Can you talk to Coloradans specifically about what actions you're looking at in order to get us right the ship? What things you might do?
Well, I think we're just going to start seeing soon the impact of this increased awareness on two fronts, the impact of the bars and nightclubs closing and the impact of this renewed urgency that people feel because of what's occurring in our neighboring states. The fact that a few weeks ago, maybe a quarter to a third of our state had a mask requirement locally administered, and now it's close to 60%. So there's always this lag factor. You know, we always see the impact a week to two after these measures go in. But we really need to leave everything on the table in terms of the steps that we need to take to keep our economy growing and keep people safe. But certainly the first opportunity always resides with the people of Colorado. So I'm hopeful that by looking at the information, by looking at what's going on in other states, more people will wear masks in public, more people will stay 6 feet from others, they will avoid large gatherings, the biggest single place that this virus spreads, 30, 40, 50 people together, parties, church, local businesses, just a barbecue in a backyard. I mean, you can have it, invite your neighbor, maybe that's it. Don't invite the whole block, right? It's a huge setback. Invite the whole block. One person's contagious, 36 people could have it a week later. So that's what we have to avoid.
Hello, Governor. Jesús Carrasquel from Noticias Univisión. Gobernador, ante el aumento de casos de coronavirus y luego de que haya cerrado los bares y los nightclubs, ¿tiene pensado cerrar los restaurantes?
Sí, ahora es suficiente y seguro para comer y trabajar en restaurantes. Todos los trabajadores están usando tapabocas y muchos de los clientes pueden cenar afuera. Hay muchas mesas afuera porque es más seguro afuera. Los clubes y los bares son un invierno donde personas son muy cerca, conversando, y es muy difícil tener las casas de seguridad que necesitan para ser un invierno seguro. Si los coloradenses continuaron y mejoraron usando las tapabocas y no tienen fiestas, tengo optimismo que no es necesario cerrar más restaurantes o otras cosas que disfrutamos.
Good afternoon, Governor. This is Patty with the Associated Press. I was looking to know if the state has an estimate for how much it's going to cost to get schools ready to open in the fall.
Well, this is in our state, this is the kind of data that you would have to collect from districts, not from the state. The state, through the COVID-19 CARES Act funds, distributed $510 million for districts. That will be accountable through the measures that were included in the CARES Act. The money that was allocated to school districts through the School Finance Act will be, again, accountable to the people publicly through the publicly available financial documents that districts are required to provide.
Governor, sorry, this is Allie Levine from 9 News. Thank you for taking the time this afternoon. Question about El Paso County, where they're seeing an increase in cases right now. As you mentioned before, we're also seeing hospitalizations rise across the state. You've touched on it in a little bit of everything that you've said, but just how important, with those two facts in mind, is the time that we're in right now to make sure that we don't get back to that same place we were in April?
Yeah, I mean, it's extremely important because we've seen Republican and Democratic governors in neighboring states have to move backward. States that have had to close gyms and restaurants to indoor dining and really move the wrong way, while of course experiencing greater loss of life. The glass is half full. We're close in Colorado, meaning we're going the wrong way, but we're talking about minor, medium adjustments to our lifestyles, not the radical changes to our lifestyle that we had to do, in April. We're talking about everybody making that effort to just socialize 20% less, to avoid large parties, to wear masks whenever you're around others. Those simple things can prevent us from backsliding in El Paso County and across the state. And I'm really hopeful that the people of Colorado are taking these red blinking warning lights seriously, and that we're upping our game. And that if we care about this progress, care about saving lives, that we are all taking that pledge to ourselves and our families that we are going to do better. We're not going to forget our mask at home. We're not going to leave it around our neck. We're going to say no to invitations to any neighborhood events or large events. We're not going to be around others more than we absolutely have to, and when we are, keep a safe distance of 8 to 10 feet or at least 6 feet.
Mr. Governor, Charles Ashby from the Grand Junction Daily Sentinel. So we're being told by our local health official that our increase in cases here, which has been quite dramatic in the last 2 weeks, is due to people from the outside coming in, out of state, from other parts of the state. At the same time, we're hearing that you've made an offer to the governor of Arizona to bring in some of their hospitalized patients to help free up space there. Is that the case? And assuming some of them will come to Grand Junction, since we're much closer to Arizona than you are, what assurances can people here have that we won't continue to spread more of the virus here?
So there are many tourists within Colorado and from other states that enjoy our state. We estimate there were between 75 and 100,000 Texans, Arizonans, and Californians that were in our state over July 4th weekend. Some people say, why don't you keep them out? The truth is there's no legal ability that a state has to keep people out. It's a free country. People can drive here, and frankly, we don't know who they are or where they are, and we're all Americans. It's one of the reasons that we need a nationally coordinated strategy on coronavirus that thus far has been lacking. That's one of the reasons that America is among the only nations that is losing this fight rather than winning this fight. But in the meantime, we certainly want to do as best we can as a state. And of course, that means, to the extent we can, helping our brothers and sisters in Arizona, because if, God forbid, we're in a dire situation here, we want other states to rise to the occasion and help us. And to be clear, what was being talked about is a medical environment for folks. If there's a need for hospitalization, there are extraordinary precautions that are taken at hospitals to protect our healthcare workers and doctors that might be attending to anybody who's a victim of coronavirus.
So you talked about not having the legal capability to keep people out, but some states have considered using quarantines to, when visitors come in from out of state, putting them in quarantine for 14 days. Would you consider that?
So there are states that talk about that, and those are generally seen as voluntary. There's no ability that those states have to arrest a fellow American with no criminal charge. Perhaps with habeas corpus they can hold them for 24 hours, but they would then have to release them. But even that's not advisable. If somebody might be contagious with coronavirus, you don't want to apprehend them and arrest them. We need a national strategy. Every European country was able to, even though they normally have free movement through the EU, they're able to lock down their borders for a period of time, and now they have the ability to travel among most of those countries. The only real way in our federalist system to do this is with a coordinated national approach. The other thing is that no matter what we do with visitors from other areas, this is very important, Coloradans should not let down their guard. Because if you work in a tourism community, work in a store, work in a restaurant, whether that customer or visitor is from Aurora or Denver or Texas or California, they may be contagious with coronavirus. And therefore, you should treat every customer, no matter where they're from, like they are contagious and take the correct precautions, including mask wearing, hand washing, and being 6 feet apart wherever possible.
I have two questions for you. What are the specific triggers you are looking for if you are thinking about making a decision for rolling back on reopening? And what do you have to say to teachers and parents who are feeling awfully nervous about schools opening in about a month?
Yeah, so our North Star has always been we don't want to exceed our hospital capacity. We are not in danger of that right now, but the trajectory is troubling. Not troubling next week or the week after, but troubling over a period of months. And that's why I think it's really important that Coloradans make this course correction now so that we're not in dire straits in several weeks or months. And these are simple things. Wear a mask whenever you're around others, stay 6 feet apart, avoid large groups, reduce your social interactions. Those are simple things. They're not fun things. They're not what any of us want to do, but they're simple things. And they're something that we all can do. And we all hopefully will do. Families, teachers, parents really feel the same stresses and anxiety that all Coloradans are going through. It's not as safe a time as it was to do any activity. It's not as safe a time as it was to even go shopping. Certainly not to work in a store. Our retail workers, our frontline people who work in grocery stores and in retail and in personal services like haircuts are, of course, taking additional risks, and they're taking every precaution they can. But there are some who've chosen not to return to work. I mean, when I had my haircut the other week, my hairstylist said, some of her colleagues aren't comfortable coming back, and some of them are able to make that decision because they have another person in the household who has some income or they have some savings. But for others, they can't forego that income. Certainly with regard to kids, there will be many parents that make the decision that they want their kids to begin the year online. And I think that the school districts have been very accommodating of that. They need to be accommodating of that. And there are others that are ready for their kids to return to school, and we need to do it in a safe way as reasonably possible for the staff at the school as well as for those students. These two will do. Yeah, Jesse.
The Colorado Department of Corrections recently released that there's been 3 outbreaks at 3 different facilities. I'm curious if you're going to take any steps to lock down those places further, if you're concerned about it, and what you see as the future of managing inmates that are infected.
Yeah, so we are going through, we have a much better established protocols around site-based outbreaks than existed several months ago. Inmates are being tested, and we are looking at both lockdowns within cell blocks as well as we have heavily restricted inter-institution transfers and will continue to. But the data from the test will indicate exactly how widespread that particular outbreak is.
Question from the phone.
Hi, Governor Mary Ann Goodland with Colorado Politics. We're hearing increasingly from business owners, whether it's restaurants, grocery stores, convenience stores, that their employees are fighting the battle of forcing customers to wear masks, a battle that they say you aren't willing to fight. What's your message to them?
Well, we can't have a police officer in every store to enforce that, and I understand it's a difficult situation for retail workers to be on the front lines of enforcing those bans, and we are looking at additional tools that can empower public establishments to do business with the public to help keep their workers and customers safer. We made it very clear under an emergency order that any business has the right to deny entry to people that are not wearing masks. But I completely understand that that's difficult to enforce. I sympathize. We want to help. We want to work on whatever executive actions we can to really prevent that kind of unsafe and dangerous activity, to protect those who work in retail and public environments. Before we get to Alex, I just want to read a few comments and questions from social media. Stephen Merriman says, Governor Polis, thanks for finding so many different ways to say wear a mask. Encouraging courteous behavior is never wrong. When that courtesy may help save lives, it would seem to be a no-brainer to afford it to our fellow citizens or even visitors. And Stephen kind of gets what I've been trying to do, say this in many different ways. They're not mutually exclusive. Some people want to hear it bluntly. Others want to look at the science and data. Others are more likely to react to a humorous message. Tanya Pierce says, please mandate mask use in Colorado. We're getting ready to go back to school, and in my district, there's a loud anti-masker parent group that's swaying the decision. And as of now, masks will be optional. We employees of the school are worried about ourselves and our loved ones, as well as the students and their families when we go back. A lot of folks have expressed the same concerns that Tanya has, and we sort of want to make sure that, like any type of environment, schools are as safe as reasonably possible in the pandemic, and certainly masks are a part of that. The Department of Education, our health officials are all working on guidelines around that. Joe Beringer says, life, liberty, and the pursuit of happiness. You have trashed all of these God-given rights, Polis. You are a tyrant and need to be out of office. You know, Joe, there's folks that feel like that. This is a public health emergency in a pandemic. Like you, Joe, I don't like masks. I don't like wearing a mask. I'm a social guy. I mean, anybody in the business of politics is. I like being around others and going to events and foregoing that. These are not easy things for anybody, Joe. But nobody's trying to do anything to you. We're all rooting for you. I hope you're rooting for the state. You're rooting for our country. These are the science-based individual decisions we need to make to reduce our interactions, wear a mask in public, and just get through this darn thing. Get through this darn thing, and together we will. Trish Edwards says about masks, because you won't make it a law, there's no consequences for compliance. A guy at King Soopers told me he had a concealed carry permit, so he didn't need to wear a mask. Do something about it. You know, if somebody says they don't need to wear a mask and has a concealed carry permit, it sounds a bit like a threat depending on the context, but just keep in mind that the governor does not have a presence there. The government does not have a state trooper there. I absolutely feel your pain. We want to create that social environment that allows King Soopers and other retailers to be safe. But there's no simple thing that I can do or that the state can do to prevent somebody from saying that to you or even from threatening you. If it crosses the line and is actually a physical threat, you can report it to local law enforcement. That is against the law, but I understand that it's difficult. Terry West McIntyre really puts a fine point on certainly something that looms large in my decision-making process. Terry says, maybe more would wear a mask if it was a statewide mandate. And I think that's a good question. I struggle with that myself. I'm trying to get data on that. We have areas with mask mandates, areas without. It certainly would help sway me towards particular policies if there was strong evidence that it increased mask wearing compliance. Others complain about how difficult masks are to wear. Stephanie Gray rebuts that. She says, I'm an out-of-shape desk worker and still bike 10 miles through downtown Denver and alongside the Cherry Creek Trail. I had a mask on the entire time, and it was totally fine. So, you know, those who have respiratory conditions, diminished lung capacity, it's actually more important that you take those measures to protect yourselves, and that includes wearing a mask in public because there's a much higher fatality rate for the virus if you were to contract it, if you have those pre-existing conditions. If you can't wear a mask and you have that much difficulty breathing, to keep yourself safe, you might want to stay at home, as my parents are, as so many Coloradans are. Ask others in your church or your neighbors to run errands for you, to bring things. There's a lot of goodwill. Lots of Coloradans are stepping up and doing that. But, you know, if you can't safely wear a mask, you really might want to consider simply staying at home. And I'll just, out of a final one, Ali Romero, in part sort of answer the last one, says, you can get masks that are so tight and thick it constricts your breathing. If your mask is so tight you can't breathe, you need a different mask. I wear mine all day as a hairstylist, and I'm all up in people's faces, and I'm fine. I can breathe just fine, and if I need a break from wearing it, I step outside for a few minutes when I'm not too busy. It's not that hard. If truly you are having trouble breathing with your mask, try a different mask. Nobody should have trouble breathing with a mask. There are cloth masks, there are scarves, there are disposable masks. Try one that works for you, that encourages your own compliance. Just like clothes, people are different. I don't like wearing wool on my skin. It makes me itchy. Some people wear wool. Try different ways of doing it. There's no one way to do it. It has to cover your nose and mouth, and it shouldn't inhibit your breathing. And if you haven't quite figured that out yet, if they still bother you, try something different, because masks should not be that bothersome. I mean, a little bit annoying, but they shouldn't get in the way of your breathing. So if it is, try something different. You're probably doing something wrong, or maybe it's just wrong for you, and you need to try a different material or different configuration. Alex, last question.
So in your recent executive order, you encourage cities to drop the occupancy limits that restrict how many people, unrelated people, can live together. First of all, can you expand on why you included that in the order? And second of all, is the reason that you haven't required this because you don't believe you have the authority, or is there a different reason?
I would like to temporarily require it. We will have our council looking at it. I don't believe that one of the reasons that the state has less authority in this area is these are local ordinances. There's no state ordinance, there's no state law to waive. So we have called upon local governments to say, temporarily during this crisis, allow people who might otherwise be homeless to live in a group that would otherwise be larger than legally allowed, whether that's 5 unrelated people or 4 unrelated people or 6 unrelated people. A, it doesn't mean a permanent change. B, it is important now because if somebody isn't living in that kind of situation, they might be homeless. And so the same type of people who complain about extra cars on the street or too many people living in a nearby house also generally complain about the homeless. So I think people just have to understand that there's a trade-off there. And for the public health perspective, we should err on the side of allowing people safe housing for the period of this. I'm not going to get into the permanent, discussion there that people have about affordability and housing and unrelated parties, and it's a big issue in Boulder and Aurora and Denver. But I hope that the public health emergency at least temporarily moves cities to remove those residency limits to allow people to be safer in a home instead of out on the streets.
One more question, please. Some school districts have said that they're not getting enough guidance from the Department of Education and from the Health Department. What would you tell those school districts?
There's guidance that will be issued in the next couple days from the Colorado Department of Education and the Colorado Department of Public Health and Environment. Thank you.